We know now that for the majority of cases, COVID is spread by droplet infections. As we speak, as we talk, as we phonate, if one is infected, you release certain droplets and they can fall soon after it's released from your mouth down. So that's one way of transmission. It's thought to be the most important way of transmission. However, our knowledge is evolving around other smaller droplets. Some may even call it aerosols, which can also transmit disease. We are not very sure how much it contributes to transmission, but we think it does. And so with the aerosols, as one speaks, you get the droplets, bloop, they fall, but then the aerosols seem to, stay in the air. And so that's another way that we think COVID could be spread. I'll say this, I would like you to picture going into a big room, and in that big room you have somebody sitting in the way back of the room smoking one cigarette. In that room, when you enter, you may smell the nicotine, or you may not, but then when you walk out, you probably will not smell of it outside. Think of the same room and 100 people in the room all smoking cigarette. So you may not, as you enter the room, be smoking cigarette, but then when you walk out, everybody may think you reek of cigarette. That's how we need to think about coronavirus. In the bus or in restaurants where we are crowded inside buildings, we are producing these droplets and these tiny aerosols. And so there is increased risk of catching the disease. Knowing this, then the best way to prevent it is to decrease the amount of people and take it outside and still space it when one goes outside. Because when you space it outside, then there's less risk of spread. And using the face mask as well. These are very important and very basic things we can do. And at all times, hand hygiene. You touch the doorknob, you wash your hands, or you use alcohol-based hand sanitizer to clean your hands.